Hi.
My name is Amy. I'm going to be your student nurse today that's taking care of you.
Hi, Amy.
I'm just going to wash my hands and I'll be right back.
Okay.
All right, I'm just going to provide for privacy. We'll
Okay.
get right started. Can you just state your name and birth date for me?
I'm a mommy, 123 of 80.
All right, it matches your name band. Thank you. All right, we're going to do your prenatal assessment today.
Okay.
I'm going to ask you a couple questions about your history, and I'm going to do a little bit of an assessment.
Great, thank you.
Okay, all right. So, let's see, when was your last menstrual period?
Let's see, April 24th?
Okay, let me put that in here. We're going to use Nagel's rule to find, and I see that you're due around the 31st of January.
That's what they said.
Okay, so that puts you at 37 weeks?
Mm-hmm.
Great. All right. So what pregnancy is this for you?
Third pregnancy. I have a daughter, and then I had a miscarriage.
Okay, so that gives you a gravida 3, para 1.
Okay.
And who is your physician?
Dr. Baby. He's awesome.
All right. Good. Have you seen him regularly?
Yes, it's about, I want to say 8 weeks.
8 weeks? Okay, and have you missed any appointments?
No, I go every time.
Okay, good. During one of those visits, did he do your blood work, find out what blood type you were?
Yes, he's A negative.
A negative. Did you get a RhoGAM shot?
I did. I've had it with my daughter during the miscarriage, and then I've had it once so far this pregnancy.
Okay, wonderful. Now, when you have this baby, if it is born Rh positive, then you'll get a second RhoGAM shot while you're still in the hospital.
Okay, that's like what happened with my daughter. That makes sense.
Okay, good. Are you on any medications?
I take my prenatal vitamins, but that's the only thing I'm taking currently.
Okay, and does it have folic acid?
It does.
All right, did you have folic acid before you got pregnant too?
Yes, my doctor actually makes you stay on it if you're trying to have a baby.
Okay.
I don't exactly know why, but I could stop that once I started my prenatal because he said it was in that.
All right. Any other type of medication that you take at all?
No, I was on Zyrtec before I got pregnant, but I stopped once I found out.
Okay. If there are any type of medications that you think you would like to take or need to take with the allergies and sinus going on, make sure, or any other problems, make sure you talk to your doctor before you start anything.
I try to be safe rather than sorry, so I really don't take anything.
Okay. There are some things you can take though, so if you, but you need to talk to your doctor before.
Okay.
Do you smoke?
No.
Any alcohol?
None.
Do you do any illegal drugs?
No.
Okay. Any caffeine?
Every so often, maybe half a cup to a cup in the mornings. I'm not a morning person.
Okay. That should not harm it at all. All right. Are you married?
I am.
Okay. Is he going to be with you while you have your baby?
He better, yes.
Okay.
He might pass out, but he'll be there.
Did he pass out the first time?
No, but it was close.
Okay. All right. Has he ever harmed you?
No, why would you ask that?
We have to ask that to everybody. We want to make sure that you're in a safe environment and that your baby's in a safe environment.
Okay, yeah, no, he's a big teddy bear.
Okay, good. All right. And have you ever been hospitalized for anything else?
I had my appendix out maybe 10 years ago, and then when I had my miscarriage, I had a DNC, and I was hospitalized overnight for that.
Okay. All right. Do you have any history of sexually transmitted diseases?
No.
Okay. You will be tested for strep B, which is a vaginal swab.
Okay.
And if you have it, we will treat it with the antibiotic.
Okay.
We just do not want it to transfer to your baby. If you do have a vaginal delivery,
Okay.
it can cause meningitis.
Oh, okay.
So we will check for that just so you know that's coming
Okay.
up. All right. We usually check that around 37, 39 weeks.
Okay,
So
so
it
coming
should
up.
be soon.
Okay.
Yes. Uh-huh. All right. Now, when your doctor was doing the sonograms, you said you've had a few, and it was transverse. The last one is it's head down now.
He is. He's moved head down for the last couple weeks,
Okay.
which was really nice because I can breathe again.
Good. And when did you deliver your daughter? How many weeks were you when you delivered your daughter?
I was early. I was about 37 weeks.
Okay. Did you have any problems with that delivery or that pregnancy?
Well, things were a little different then. I had high blood pressure, and I forget what they call it,
Preeclampsia.
preeclampsia.
Okay.
So I had high blood pressure, and they ended up having to induce me early.
Okay.
And I labored forever, and I couldn't do it, so we ended up with a C-section with her.
Okay. How did they induce you?
They used a medication, Pitocin.
Pitocin.
Mhm.
Okay.
It went through my IV.
Okay. Are you planning on having a C-section this time?
We're leaving it open since I don't have the blood pressure problems. He said potentially I could try for a vaginal delivery. He said it's possible to do after a C-section, but we also know that because of what happened last time, we're going to just keep our options open.
Okay, great. Do you work outside of the home?
I do. I'm a teacher.
Okay. What grade do you teach?
3rd grade.
All right. Are you on your feet a lot?
I am, but since I've been pregnant, I've tried to be really good about sitting down during my breaks and during recess.
Do you get swelling in your feet and your ankles?
If I don't sit down regularly, I do. So when I get home, I definitely put my feet up on the recliner.
Okay, and then the swelling goes down?
Yep. Nothing
Okay.
like my daughter. I was huge with her, but no
Okay.
problems this time.
Well, that's with that high blood pressure, the preeclampsia. You want to make sure that you watch and make sure that that swelling does go down.
Okay.
Because you will have swelling. You'll have some vision changes. Have you had any vision changes at all?
None.
Okay, so you'll see spots. You might have some upper gastric pain, blurred vision. You want to make sure any of those things, you call your doctor immediately. Okay. All right. Do we have any cultural or religious concerns that we need to prepare for? Okay. How tall are you?
5'9",
5'9". All right. And how much did you weigh before you got pregnant?
150.
150. And how much do you weigh now?
My last weight check, they said I gained 16, so I guess I'm at 166.
Okay. All right. And how about the movement of your baby? When did you first start feeling him move?
Man, maybe 14, 15 weeks. It was earlier than with my daughter.
Okay.
But he's pretty active.
Okay. And has there been any change in movement?
No, as he's gotten bigger, it's like more obvious and almost a little painful, but the amount that he's moving is pretty much the same.
Okay, great. After you delivered your daughter, did you have any postpartum depression or baby blues?
Well, I mean, it was hard. You don't get any sleep, and the baby cries all the time, and I breastfed, and that was a little nerve-wracking, but nothing
Okay.
out of the ordinary, and it cleared up pretty quickly.
Okay. Are you planning on breastfeeding this time?
I am. It's making me a little nervous, though. I forget the beginning part. I kind of remember it being hard,
Okay.
so I'm kind of scared about that, and I was hoping maybe I could talk to somebody about that.
Absolutely. We have a full staff that will help you with your lactation. They're
Okay.
lactation consultants, so they will help you once you come in the hospital, answer questions beforehand, and then also help you to actually breastfeed.
Okay.
Okay.
I think it's important to do. I'm just nervous.
Yeah. All right. Do you have any cats in your home?
I do, Griffey.
Are you staying away from the litter?
Yes, since I found out I got pregnant, my
Okay.
husband, it's his duty now. The doctor was very adamant that I do not go near the cat litter.
Okay. All right. I'm going to go ahead and take your vital signs now.
Okay.
So your blood pressure, your pulse, your respirations. Get us some numbers, okay?
I hope they're still good.
I do too.
My doctor said he likes it to be that top number under 140.
Okay.
And so far, it's always been that.
Has it? All right, great. Go ahead and relax. It's 124/78.
Great.
Just go ahead and just relax. Okay, your pulse is 90 and your respirations are 16.
You guys are so tricky. You always get our respirations when you're checking the pulse. That's funny.
Well, we don't want you to breathe any differently. Let's get your temperature. All right, 98.8. And we'll get your pulse ox, which just gives us the oxygen level in your blood.
Okay.
All right. Need the one finger. $97%.
Is that good?
The highest you can get is 100. All right. Okay. I'm going to go ahead and Listen to your lungs. Let me get these numbers down. Have you had any problems, shortness of breath, coughing, wheezing, any kind of pain in your chest at all?
No, when the baby was a little bit higher, I had some trouble breathing. It's like when I went upstairs, I noticed it, but it went away real quick, and I did talk to the doctor about it. He said it was real normal based on positioning.
Right. Did he tell you what position your baby was in?
Well, at that time he was transverse. I think he said it meant it was
Sideways.
Sideways, and that's what the problem was. But he's now head down, so
Okay,
he's
good.
not in my lungs as much. It just means he's on my bladder.
Yeah, it does. But your baby will shift down. It's called lightning. So then it kind of lightens up on you.
Makes sense because I do feel like I'm lighter.
Okay. Let me go ahead and take your. Listen to your lungs. Deep breaths. Good. Breathe normal. Are you able to sit up a little bit? I can listen to your back.
Sure.
All right. Deep breaths. All right, go ahead and breathe normal. Now, are you wearing a supportive bra now?
I'm trying to.
Okay, you want to make sure that you're wearing a supportive bra now and also later when you're going to be breastfeeding.
Okay.
Okay? All right. Have you had any pain in your calves, your lower leg?
No.
Okay, I know you said go ahead. Can you uncross your feet?
Uh-huh.
Thank you. I'm going to just check to see if there's any sign of blood clots. Just relax your leg.
Okay.
Okay. Any pain now?
No.
All right. Same on the other side. Any pain?
No.
All right. See, let's check for swelling. Did they do any other tests on you for gestational diabetes?
Oh, yes. About 28 weeks I had to drink that yucky stuff,
Okay.
but I passed.
Okay,
so
good.
I think I'm okay in that department.
Okay, you're not swelling
then-
today.
I had a couple extra ultrasounds at 20 weeks, I think. They said that my placenta was low, so they wanted to keep their eye on it. But they kept checking it, and at the last check, they said it was fine. So whatever the problem was went away.
Okay. Are you having any bleeding now?
Nope.
Any other type of fluid leakage?
No. Mm-mm.
Okay. All right, I'm just going to check your reflexes.
Okay.
All right, just relax your leg.
Okay.
Okay. Good. Same way, just relax.
Okay.
Good. Now check up on your elbows. Relax your arm. Good. Okay. Now I'm going to go ahead and check your belly.
Okay.
I'm going to raise this up.
Well, I'm a little embarrassed to show you. I've got a rash or something. It
Oh,
really
okay.
itches.
All right. How long have you had this?
Well, at first I thought it was just stretch marks. Started maybe 2 or 3 weeks ago, so I guess like 35 weeks.
Mm-hmm.
But it itches so bad, and I had stretch marks with my daughter, and they never itched like this.
Okay. Do you know what sex you're having this time?
A little boy?
Little boy? Okay. Keep calling him he. I want to make sure.
Yeah.
What this looks like is something that we call PUPS.
Okay.
Which sometimes pregnant women get. It's very treatable now, and it does go away.
Okay.
But it is irritating to you.
Yeah, it just itches. It wakes me up at night.
Okay, so if you talk to your doctor about it, he can probably get you some cream
Okay.
to put on it to help with that itching.
So it's not going to hurt the baby.
It's not going to hurt the baby.
Okay, good.
All right. I'm going to go ahead and feel and see if I can feel where the baby
Okay.
is. All right. Any pain at all when I'm touching?
Nope.
Okay. Yep. There's his head. Well, he's kicking me. All right. Now, when you had your sonograms, did the doctor also take a tape measure and measure what we call
Yeah,
fundal height?
he did. I wasn't sure what he was doing, but he always said it was measuring on track, so whatever
Okay.
that means.
He's just measuring to see where the uterus is growing in the right pace. Okay.
Yeah, he seemed to say everything was okay.
All right.
Knock on wood.
Now, when you start to have contractions, have you had any contractions so far?
Just some irregular things. I think,
We could go ahead and put your shirt down.
I guess, like Braxton Hicks almost feels like menstrual cramps, but
Okay.
nothing real and nothing consistent. Sometimes it just gets a little crampy, and then it'll go away, especially if I drink water.
Okay. You want to make sure you continue to drink that water and keep the fluids high.
Okay.
If you start to have more contractions more frequently and they're stronger, then you need to call.
Okay.
Or if any type of leakage or bleeding.
Okay.
But you'll be feeling it in the top, what we call the fundus. That's people are going to refer to that. That's the top.
Okay.
That's where you're going to be feeling it.
Okay.
Have you had regular bowel movements?
Yeah, everything's been moving fine.
Okay. And how about urinary? Have you been going to the bathroom?
A lot at night, especially when he started moving down and landing on my bladder, but nothing out of the ordinary.
Okay, good. Well, that concludes this assessment, so thank you very much for letting me be in here and to talk with you today.
Oh, thank you.
Do you have any other further questions?
No, you've been very helpful. I'm definitely going to follow up with my doctor about the rash and then talk to a lactation consultant. That's going to be really helpful, I think.
Okay, wonderful. I see you have a non-stress test scheduled, so
I do
I'm going to
today.
have you get to the side of the bed, get your shoes, and I'm going to walk you down the hall.
Awesome. Thank you so much, Amy.
Okay? All right.
Good morning, my name is Regina and I'm here to do your non-stress test today.
Good morning.
I see that we have a student with us today. Good morning, Amy. You're welcome to stay if you like. Can you give me your name and birthday, please?
I'm a mommy, 1/23/1980.
Great. Okay, I'm just going to sanitize my hands right quick. I will be hooking you up to the monitor.
Okay.
This test should take us approximately 20 to 30 minutes.
Okay.
I'm going to raise your legs. We'd like for you to be comfortable while you're doing this.
Okay. Now-
Lean you back just a tad.
Does this hurt?
No, not at all.
Okay.
Not at all. It's no stress at all. That's the reason why it's called non-stress test.
I did wonder about that. I thought, well, I'm not under stress. I don't know why he's ordering this.
Well, we're just going to check on the well-being of the baby. This test will show us if the baby is getting enough oxygen and if the placenta is functioning
Okay.
well. What I'm expecting to see in this 20 to 30 minutes is 2 accelerations in the baby's heart rate.
Okay.
15 beats above the resting heart rate.
Okay.
So let's just say the baby's resting heart rate was 120. I should see it go up to at least 135.
Okay.
And come back down, and it should do that twice for me.
So if it goes up, it's a good thing.
Yes.
Okay.
If you get 2 of those, then we call your test reactive.
Okay.
And then you get to go home today.
Oh,
You get
good.
the 2 points. If not, then I will send you to ultrasound, and you will get a biophysical profile. That's an ultrasound where they'll check the tone, the movement, the breathing, and the fluid around the baby.
Okay.
So you'll be able to get 2 points for each of those. So if you lose 2 points in here, you need to get all 8 points back there to go home.
Okay.
And if not, then we'll send you over to the hospital for further monitoring.
Thank you.
Every time you feel the baby move,
Okay.
I'd like for you to push that button for me.
Okay.
Okay, so when is your due date?
End of January.
Okay. And what number baby is this for you?
Third pregnancy, but it's my second baby.
Okay. So Amy, I'm going to show you a few things, like how we hook her up to the monitor. This is the Toco, and we will find the tip of her uterus right at the top, and we'll place that there. This tells us if she's having any contractions.
I hope not. It's still a little early.
Yes, it is. We don't want to go too early. All right, and this is the ultrasound. This is what we'll find the baby's heartbeat with. This should be nice and warm.
It is. Feels good.
Great. Wow, your baby's very easy to find.
Is that his heartbeat?
Yes, it is. All right, I'm going to have you tilt just slightly to your left. I'm going to get your blood pressure, and then after that, we just want you to relax for the next 20 minutes. Okay?
And you said this button whenever I feel him
Feel the
move.
baby move. Yes.
Now, he's normally kind of sleepy during the day. He's up all
Okay.
night. Is that a problem?
No, it's not a problem because sometimes babies do have sleep cycles,
Okay.
and sometimes they're up all night and they sleep all day. So I'll give the baby a little time on the monitor,
Okay.
and if it does not respond, I will use my little buzzer, and we'll see if we can wake the baby up.
Okay. I think he heard that. He just moved.
Great. Okay, it looks like you're almost done. You have a few more minutes left on the monitor. Baby looks great. It's giving me the 2 accelerations that I need. I don't see any contraction, so today you will get your 2 points for the test.
Oh, good. So I passed.
Yes, you did.
Okay.
Do you have any other questions for me?
Well, I was mentioning to the student nurse earlier, and I see that you have a poster over there. I'm really nervous about breastfeeding. I
Okay.
did it with my daughter, and it just wasn't the easiest.
Okay.
And I didn't know if there was some resources or anybody I could talk to about that.
Sure. As a matter of fact, I have some brochures here for you. We have one on lactation consultant,
Okay.
and they'll be able to help you in the hospital and also do some follow-up with you once you go home.
Okay,
So
great.
they have a great program for that, and we also have a childbirth education program if you want to take some childbirth classes.
Now, can I still do that even though it's not my first baby?
Sure,
Okay.
absolutely, absolutely. Actually, if you sign up for this class, they have a cute little swaddler that they can give you for the baby.
Oh, that's cute.
Yeah, that's nice. Well, there's one more thing. I'm going to give you this fetal kick count sheet.
Okay.
And at home, at least twice a day, you need to check to see if the baby's moving 10 times within a 2-hour period.
Okay.
Okay, and you can just mark it on this chart. Sometimes if you have a hard time getting those movements, we'll have you lay down on your side, drink something sweet or something really cold.
Okay.
And then you'll see if you can get them. If not, then there's a number here that you can call and speak to someone in triage.
Great.
All right?
I can handle that.
Okay.
Thank you.
There you are.
All my
And it
goodies.
looks like our test is all done.
Yay.
So I'm going to get you all cleaned up, set you up, and I'll see you next week.
Awesome. Thank you so much.
You're welcome.